So I'll be very fast here, where it's the big application of laser is about enucleation, but started also 10 years ago with vaporization, mainly with green light. And the first we had was HOLEP. So with the holmium enucleation, we saw a beautiful procedure done with holmium today. And but as I underlined, the interaction and what the laser do with different tissue is different according to the laser wavelength, to the laser chromophobe, to the laser aspect, and to different other things. So this is one of the most important slides we can have, is the interaction of holmium with the tissue. So the first thing that we must keep in mind is that the depth of coagulation is 0.3, 0.4 millimeters. So it's quite superficial. We have a wavelength of 2140 with, and the chromophobe is the saline. And holmium is a pulsed emission. We don't have any continuous holmium, so it's always pulsed. And any one of us is a good urologist and know that a good application, the big application of holmium is with stone, because we break stone with the pneumatic and the wavelength that holmium do with the stone. This is the equipment we are using, and you already seen. So fibers, generator, morcellator, and that's it. And then we have enucleation and morcellation. But we can easily shift to this one. So keep in mind that the interaction of holmium with the tissue is a pulsed interaction, make a good detachment in between different planes, so a good detachment in between capsule and adenoma, and breaks things that are strong, like stone. This is why we use holmium with stone, and we use holmium to detach the adenoma from the capsule. I can tell you that in the last 5 years, different companies have developed different applications, because if you're using holmium in water, you will generate bubble, because it's a sort, and when a bubble is generated, then the bubble collapses. And from this kind of situation, they have set up Moses, Bubble Blast, Virtual Basket, so a lot of different tools that helps you to have not the stone going away, and to have a better control of the hemostasis. If you are doing an HOLEP with the Moses technique of the virtual basket, depending on the name, but it very works well, you have a better control on the hemostasis, because you have two bubbles that are acting. One is the one that is detaching the tissue, and the other one is the one that is coagulating. So any tool in holmium is helping us to do a better enucleation, just keeping in mind that is always an interaction in between the laser and the tissue. Then we have thulium. Thulium is a little bit younger because it was born in 2010, and this is the second most important light of all the talk. So we have the wavelength is quite similar, so it's not that different. So that makes that to use thulium in a safe way, you have the chromophore saline 2. You can have a continuous or a pulsed emission. So it's a very good. And the other thing is that is more superficial than holmium is. So the depth of coagulation is 0.1, 0.2. Why I'm telling you this? Because the big criticism in all the laser stuff done by all the great resectors of the prostate were about irritative symptoms. So they say, well, I'm not using the laser because it gives a lot of irritative symptoms. I prefer the TURP. I prefer the transvesical enucleation. The irritative symptom depends mainly on two factors. One is how deep is the laser you are using. So the superficial is, the better is. So if you have a laser like thulium or like holmium that are really superficial, you can just have less irritative symptoms. And the second part is about how long you stay on the same area with your laser. So the spread of energy. So if you are spreading a lot of energy, and if you are using a laser that is very deep, your patient will experience irritative symptoms. If you are fast and you are abandoning the part that you are lasering in that moment very fast, and you are using the correct laser, you won't have any irritative symptoms, or this will last for just few hours or few days. The equipment is just the same, absolutely the same. So this is just to make a comparison to give you some key point. Wavelength is not that different, and this similarity makes them working on the same chromophore, so the saline. You can use the thulium with continuous or pulsed, and then we have also the thulium fiber that can be continuous or pulsed too. And then we have the holmium that is just pulsed. And the depth is a little bit more with holmium and a little bit more superficial with thulium. So that makes one of the differences is about the blood loss. We saw that mainly is a fact of the patient. If we have a patient with an indwelling catheter, with a big prostate, who was not taking dutasteride, is more likely to have a more bloody procedure than one that has no catheter, was taking dutasteride, so it's different. But with thulium, you have a better control on hemostasis. And I'm just finish up this short presentation about the guidelines. We saw a very nice presentation before about guidelines, and all the guidelines actually, and I know that I'm me and Gomez Sancha are completely agree saying that TOP is no more the gold standard, but enucleation is. But according to guidelines, we have less time to prove it. So we have very good results, but we have less time in which we tested HOLEP, TULEP, TFLEP, and so all these guidelines say that the evidence are weak, not just because we have no good result, but we have good result, but for a short time. So this is why big recommendations are about vaporization with little prostate and a very few rate of patients that actually cannot do the morcellation and are taking a lot of anticoagulants or antiplatelet drugs. The other fact is about the technique. So this is my wine. As I told you, I prefer to detach the different lobe, but you can do en bloc. Is something that you have to adapt to your equipment and to your patient. But another fact is that about the green light. So green light laser started, and yeah, I finished. I started with vaporization and then shift to enucleation. Green light is deeper than holmium and thulium, is 1 or 2 millimeter, so 10 times more. Equipment is the same, but they have shifted and they have done very nice results. So even if you are using thulium, holmium, green light, enucleation is surely an option. And the only things that change is your patient, and the laser you're using, because enucleation is enucleation is enucleation. Thank you very much.
Only one question.
Yeah.
Several companies are developing different lasers, and we are now available. I don't know if maybe 15 different lasers. And for me, the problem it is not the laser. I don't miss something of the laser. I feel comfortable doing it. I go fast. I go safe. I have no bleeding. I like it very much. I think the problem is in the morcellation. What do you think about this?
It's absolutely the key point, because you can do the best enucleation with the device you want, but if you are not able to do a good morcellation, your procedure becomes a nightmare. A nightmare. We will see in the next presentation morcellation process, morcellation procedure. I will have 2 slides just to make in comparison all the morcellation of the market, but that is real the key point of all the procedure. If you don't have a correct suction, you are dead. If you do have an old morcellator with no good teeth and not rotating money forward and backward, is a mess, because you can make a big hole in the bladder wall. So it's always forward and backward is a mess, because you can make a big hole in the bladder wall. So it's always something that you need to